Thanks so much, Jenny, and really nice to meet everyone. Great to see there's such a good number here. My name's David, so I'm a GP. I'm also director of the Better Sleep Clinic, and I've been working in sleep for several years. I find it an absolutely fascinating area to work in, particularly when you have someone who's got a really deep-rooted sleep problem. So obstructive sleep apnea is always a really good example. It's the first sleep condition that I worked with. That actually, when you find someone with good-going sleep apnea who hasn't slept properly for what could be a decade, who falling asleep as soon as they get in from work, falling asleep at the wheel, mimicking dementia sometimes with how it impacts them, and often depressed, that actually the diagnosis and the treatment's quite straightforward, but sometimes it's like 2 days later that you're looking at a completely new person. And it really highlighted to me the role of sleep in health and well-being. So I think, to be fair, sleep is quite a vague process, but actually when you see the impact of restoring good sleep, it makes it a really addictive place to work. So thank you for having me today. So I'm going to talk about occupational sleep health and well-being. So a bit about our clinic. So as I said, so I work for the Better Sleep Clinic. That's our clinic. We're UK-wide. We treat sleep disorders on a one-to-one basis. So it's mainly sleep apnea, insomnia, and various other conditions. But we also work with a lot of organisations. So we work with workplaces, because sleep is a huge part of work, as we'll find out later. And we also work with high-performance sports. So work with Premier League, Formula One, the Olympic team. And it's interesting about a crossover, actually, when you look at performance from a work setting and from an athletic, which I'll chat about during the talk as well. So what I want to talk about, the reason I want to talk about sleep is really for three fundamental reasons. So the first thing is that poor sleep is really common. Poor sleep impacts your well-being and your ability to work, and crucially, poor sleep can be fixed. More specifically, what I want to talk about, so I'm going to talk a bit about the background to sleep, because it's interesting, but also because it gives you that really helpful context to understand why sleep impacts our physical and our mental health that way. I'll talk about the impact of sleep in the workplace quite specifically. I'm going to talk about how to get yourself sleeping better, because when you understand how to get one person sleeping better, you get an idea about how to get workplace sleeping better. I'll put Q&A at the end, but if you have any questions on the way through, just give me a shout and we can do that. So firstly, why do we sleep? And it's a bit of an unusual question to start with, because we're not actually that sure, which is an embarrassing thing to have to admit. But the reason is sleep's a really difficult thing to research. And the main reason is that when someone is asleep, they're unconscious and you can't study them. So for that really basic reason, sleep research is a challenge. And so what you're often left doing is researching sleep from half a step back. So you get large groups of people who don't sleep well and you see what happens to them. And we know that there's no body system that escapes unscathed from poor sleep, but the system most affected is the brain, which makes us think that sleep is primarily a neurological process. But there are other things that you'll probably recognise. So physical rest and recuperation. So there's the physical component to rest, and a lot of that comes back to your hormones. So if it's actually during sleep that things like growth hormone and testosterone are released, and these are important for growth and repair. So if you're missing out on sleep, you miss out on growth and repair. In a similar way, large parts of our immune system are actually protein-based in the form of antibodies. And so if you miss out on sleep, you don't restore your immune system in that way. And this is why, if you have been burning the candle at both ends, that you often end up with a cold, that's what's happening, that your immune system has a bit of a prime. Loads of research on memory formation. So if you look at the difference between trying to learn something and then when you're tested on it, if in that intervening period you sleep, your recall is loads better. So it's called memory consolidation, going from short-term to long-term memory. And it's not just list learning, but it's also things like muscle memory. Emotional regulation. So I think all of us would probably admit that if we haven't slept well, that we are a little bit cranky. And what that comes back to is a specific state of sleep called REM, rapid eye movement, which you might have heard of, which I'll talk about later. And the final one I've got down there is sleep's role in clearing out brain waste products. And this clearing out happens almost exclusively at night. And what gets cleared out are things like, I don't know if you've heard of things like proteins called tau and amyloid. So these are the proteins that are implicated in Alzheimer's dementia. This is why, if you look at big populations of people who don't sleep well, that actually they do get Alzheimer's dementia at an earlier point. When we think about the importance of sleep, I actually think that with healthcare, there's so much information that it's actually quite difficult to navigate all of this. And sometimes it's easier to actually hack it right back to the bare bones. And what you're left with is something called the 3 pillars of health. So you can't get more basic than this. So this is exercise, nutrition, and sleep. And it's not really about any one of these being more important than the other. It's about all 3 being present. But you can see how fundamental sleep is to our health and well-being. More specifically, when we think about the impact of sleep on our health, you actually only need to think back to the last time that you didn't sleep well and think about how you felt. But you probably felt awful. You probably felt physically fatigued. You couldn't concentrate. You couldn't remember anything. And you were really cranky. And that can be after one night of poor sleep. But if you don't sleep well for a week or a month or a year or 5 years, actually the impact on your health is a lot more sinister, and it affects both your physical and your mental health. I don't want to kind of go into too much statistics, but the key point here is that there is an ocean of really robust evidence that supports this link between poor sleep and poor health outcomes. So I've picked a few of the big ones here. So this was a huge study that looked at cardiovascular disease and sleep. So we know that if you don't sleep well, you get more cardiovascular complications. And what that comes back to is really what's going on when you're asleep. So when you're asleep, your heart rate is lower, your blood pressure is lower. So it's a state of relative cardiovascular relaxation. If you think that we sleep for probably on average about 8 hours, so that's about a third of a day, so it's about a third of our lives. If you're habitually short sleeping, you're spending a significantly increased amount of time in that more stressed cardiovascular state. And so the natural process of arteries furring up just happens at an accelerated rate. So you get more heart attacks, strokes, high blood pressure, kidney problems, and so on. The diabetes is another big area, and actually this was a study that looked at sleep and said that it was really a comparable risk factor to traditional risk factors for type 2 diabetes, like being overweight. And actually most diabetes clinics will now talk about sleep because this is a key risk factor. One of the main areas being researched at the moment is sleep and mental health, and the term that you will come across is the bidirectional relationship between sleep and mental health. And what this means is that we've known for years that certain mental health conditions will impact your sleep. So anxiety can make it quite difficult to fall asleep. Depression famously causes early morning awakening, not all the time, but quite often. But what we know from research is it actually works the other way as well. And poor sleep will actually cause anxiety and cause depression. And the significance of this is that if, as a system, you have a situation where poor sleep is both a cause and an effect of a mental health condition, that it can feed into itself, and you get these rapidly escalating situations where both your sleep and your mental health are escalating. And in these situations, the evidence shows that you should address both individually, so both your mental health and your sleep. And there is some unpublished research at the moment from the northwest of the UK that looked at referrals to IAP, so improving access to psychological therapy, so the talking therapies for mental health conditions. That if there was a sleep component, the research, what they did is they skimmed off those with a sleep component to their depression or anxiety and gave them focused sleep support. And actually the referral on to mental health services was reduced by about 40%, which is huge. So you can make a huge difference to your mental health if you improve your sleep. Workplace safety. So there's loads of different statistics on this. So this was a study from 2006 that showed that actually all workplace accidents are increased if you're not sleeping well. So this was 75% increased odds of a workplace accident resulting in permanent disability. So that's not just, tripping over and spilling tea. These are major accidents. And there's also quite a lot of statistics on accidents resulting in enormous workplace payouts as a result of poor sleep. But the statistic I find probably most challenging is about the road. And this research has been showed up by lots of different studies, or that statistic has been shown by lots of different studies. So it's about 20%. So 1 in 5 road traffic accidents are linked to poor sleep, which I think is hugely challenging. But when you look at this slide, what I find is most striking is that there really isn't a single part of your life that is not impacted by poor sleep.
David, I have a quick question. Just
Yeah.
you know, they talk about like daylight. I'm listening with the clocks changing coming up. There's obviously that link with cardiovascular disease. Well, there's a study done that said about the number of heart attacks increase. What's your thoughts around that? Is that something that you see, or I know people talking about it from reflecting back on my A&E days, that there was times people would talk about it, but I don't know if that's still a recognised thing that happens.
It's a good question, and it's the sort of research that is always talked about around this time of the year. So obviously the clock's going back. We have to get it wrong. And so I think it's more of an issue in spring when the clocks go forward and you lose an hour of sleep. There was big population studies that suggested that you had more complications due to that short sleep. I actually think that the data on that is not quite as solid as people once thought it was. I think it's unclear if you do get more cardiovascular kind of complications like the major heart attacks. And I suppose the reality is that if you're on the cusp of a heart attack, you're probably going to have one sometime that month. But it might be that extra stress of short sleep might bring it forwards slightly. The other statistics that you do see is about increased road traffic accidents when the clocks go change by now, because people are suddenly driving in the dark. But again, we look at large studies. I think it's not quite as clear as people think. It probably is better to avoid clock changes for those people who are right on the limit of what is workable sleep for them. If you then lose an hour, then that tips the balance not in your favour, and you can end up with problems.
Thanks.
So I was going to talk just quickly about sleepiness and fatigue. It's great to hear that a few of you are interested in fatigue. So sleepiness and fatigue, they're clearly related, but they are in fact different. So we would say that sleepiness is really about nodding off. So it's that urge to fall asleep in situations where wakefulness is intended. Whereas fatigue is more that kind of physical and mental exhaustion, which can relate to poor sleep, but it's also related to other medical and health conditions. So one way that I think is quite good to kind of understand the difference is if you had, for example, a very physical job, if you worked in construction, for example, and had a physical job there, that you might get in from work physically quite fatigued. You sit down in your chair, and I always think that if your phone was on the other side of the room, then it started ringing, you think, I really can't be bothered to get out of the chair. So you'd be physically fatigued, but you wouldn't necessarily be nodding off. So they are different, but certainly situations, so sleep disorders, which can lead to sleepiness, can also lead to fatigue, but they are a bit different. So onto the workplace impact of poor sleep. So to pick up on a few things that I did mention a bit earlier. So one of the big areas, the big ways that sleep impacts the workplace is through happiness. And this really comes back to that bi-directional relationship between sleep and mental health. Again, if you have a workplace situation that means that you're not sleeping well, it does tend to have a negative impact on your well-being, on your mental well-being. And what we know about mental health is it actually impacts workplace culture and all those around you. So it can spread. So even if the sleep disorders aren't affecting everyone in the workplace, this can be quite a contagious issue. This is a really good study on absenteeism. This was an enormous study from the USA that looked at sick leave for those who have insomnia. And it found that there's over 14 additional days off sick if you're not sleeping well, which is huge. So that's in addition to what you normally have. So it's basically 3 working weeks. But what's really interesting, and I'll talk about this a bit later on, is that it's uncommon that people call up and say they're not coming in because they haven't slept well. That it normally gets put through as something else, as MSK or flu or something like that. So this is an issue that often goes under the radar. And there's only been a few studies that have really got to the bottom of what's really happening with absenteeism and poor sleep. And it's not just sick leave, but it's also burnout, which can be extended time off or people leaving roles. And so it's not just about missing work, but it's also about how the way you work is changed if you're not sleeping well. And this idea about presenteeism, and the same study actually showed that there was pushing 30 days of additional loss through presenteeism. But it's not just the frank productivity, but it's also losses in creativity and innovation, which are probably a bit more difficult to quantify. in terms of performance, so as I said, we work in high performance sport, and we break performance into three. So we say there's a physical performance, a cognitive performance, and an emotional performance. And actually, all three areas are impacted by poor sleep, but particularly the last two, particularly cognitive and emotional performance. And so you can really see how that is a parallel between sport and the workplace. If you're not delivering as much from a cognitive and emotional point of view, that you are not going to be able to work as well. So some slightly different stats here on accident risk. So this one looks at reporting industrial accidents, and this is 8 times more likely to have happened in the previous month if you have insomnia. And then staff turnover. And this is obviously a really big issue, particularly if you struggle to recruit or there's a lot of training, that you do get a lot of staff leaving. And it's uncommon, particularly if someone's leaving because of burnout, it's very uncommon that sleep is not cited as one of the issues. And then this final stat here, so it's like 40 billion. I'm never really sure about the statistic because I'm not sure 40 billion really means a lot to a lot of people. I suppose the point is that it doesn't just affect individual workplaces, it really does affect economies as well. So how to sleep better? So I'm going to start with individuals, and then I'm going to go to workplaces. So I wanted to talk about the control of sleep. So the control of sleep is absolutely fascinating. So sleep's a vital process, just like eating and drinking. In fact, you can actually survive longer without food than you can without sleep. But sleep, unlike these other processes, has been placed outside of our voluntary control, which is really quite strange. But it actually gets stranger because the more you try to sleep, the less likely it is to happen. Something you're probably already familiar with. So there really is nothing quite like sleep. And certainly within our clinic, a lot of the questions that we get arise from this frustration at not being able to control sleep. Either you can't sleep at night or you can't stop sleeping during the day. So broadly speaking, there's 2 systems that control sleep. The first is this idea that the longer you're awake, the more sleepy you feel, which most people are more or less on board with. What it comes back to biochemically is this substance called adenosine. So whenever you're awake, your body makes adenosine. The adenosine accumulates, and the more adenosine you have, the more sleepy you feel. And the only thing that can get rid of adenosine is sleep. So basically, the longer you're awake, the more sleepy you feel. The best way I think there is to really understand this is to think back to the last time that you stayed up all night, whether that was for work or traveling or socializing or looking after kids, or whatever the reason, the experience is usually the same, that you go past your normal bedtime, you start to feel sleepy, you'll yawn, you'll think about your bed, but you can normally push through. So most people can make themselves stay awake if they need to, but it gets progressively more difficult as the night goes on, usually reaching a peak at about 3 or maybe 4 in the morning. This is when most people doing night shifts will say that's when it's most difficult to stay awake, that you can't think about anything, you can't concentrate, you can't remember anything, can barely keep your eyes open, and you feel cold, which I'll talk about. But what's interesting is that as the night goes on, as you get closer to say 8 or 9 in the morning, you're starting to feel more alert, even though you've been awake for longer. So it can't just be how long you've been awake for that governs how sleepy you feel. There has to be something else, and there is, and that's the second system that controls sleep, which is called the circadian rhythm, which you might have heard of, also known as the internal body clock. So this is this natural rhythm, this natural momentum we have that tells us, is it day or is it night? And we've evolved this because as a species, we're very reliant on light to carry out our activities, that we're not a species that can hear well. We can't sniff our way through a forest. We have to be able to see to be able to do things. And so we've evolved to be active during the daylight hours and sleep at night, which just carries on with its own momentum. And that's one of the key ways that our sleep is controlled. And you can see the 2 systems here. So in pink, you've got this, the pink line, this is your circadian rhythm, just fluctuating along the bottom. And then in yellow, that's your adenosine sleep drive. So this person's woken up at 7 a.m. and because they're awake, they start building adenosine. And the more adenosine they have, the more sleepy they feel. So that drive to sleep is built through the day. Your circadian rhythm kicks up into the wake phase and keeps you alert during the day, but it takes this downturn in the early evening, which corresponds to a really high adenosine. So the distance between these 2 lines is quite great. So this person has a strong urge to fall asleep, which for this person happens at 11 p.m. And you can see that because they're asleep, their adenosine drops right off. And this happens during the lowest phase of their circadian rhythm, during the sleep phase. And circadian rhythms are rhythm. They have a beat. They're consistent. So they kick up at the same time. So these are the people who wake up at 7 a.m. whether they've got an alarm or not. So that's a circadian thing. And so as they wake up, they're awake and they'll start building adenosine. So that process just happens again. So that is a normal day of sleep control. And so this is how it tends to work in health. But this system can be disrupted. It can be trumped. It can be overruled. And it's actually really important that this can happen. And so the three things that will disrupt this are stress, worry, and anxiety. And the reason it's so important that these things can happen is if you think about how vulnerable we are when we sleep, that, historically we would have been laying on the floor for what could have been 10 hours with our eyes shut, not listening, not paying any attention at all. So it's a really vulnerable state to be in. And so the way that you offset the risk is in the pre-sleep period. So in the pre-sleep period, if you perceive any stress, any threat, any worry, your body's response is to stay awake. And so you could imagine that, if back in the day, we used to sleep in caves as cavemen, and, if you had a really good sleep routine, so you had that circadian downturn in the early evening, and this corresponded to a really high adenosine because we'd been up all day. So the situation was absolutely perfect for sleep. But if that precise moment you were going to go to sleep, a saber-toothed tiger walked into your cave and you went on to sleep, you'd be eaten, you'd be dead, that'd be the end of you. And so when you're confronted with that stress or threat in the pre-sleep period, your body's response is to stay completely alert, completely awake. And now if we fast forward spectrum of stress, worry, anxiety with that same very potent ability at stopping us from sleeping. And it can really be anything. So, we see big things in our clinic. We see things like, bereavement, health scares, financial problems. But actually anything that causes stress will stop you from sleeping. So job interviews would be a good one, or an exam, or an early flight is also famous for disrupting sleep. But what's really interesting about things like insomnia is that even worrying about sleep itself will actually stop you from sleeping, which is often very relevant. So if you look at things that you can find in the workplace that can disrupt your sleep, so stress, worry, and anxiety would be the top one. And there's loads of opportunity at work for stress, worry, and anxiety, both at work and at home. If you think about the circadian system, so one of the main factors that controls your sleep, so this can very easily be disrupted. So shift worker syndrome is good. So the difficulties you get with sleep and other areas of function due to shift work, because you're trying to sleep at your circadian day and trying to work in your circadian night. And this is a huge issue because so many more industries actually demand 24-hour work now, particularly in construction, but also with hybrid working, because one of the ways that our circadian systems are actually set up is in response to light. And so if you tend to work from home and you don't really get out of the house, it's quite easy if you've got a busy hybrid routine to find that you've actually got to Thursday, you've not actually been outside. So it's easy that you end up with quite a shaky circadian rhythm. There's also specific sleep disorders. So obstructive sleep apnea is a really relevant one to the workplace, particularly construction, which I'll talk about in a sec. And then also young children. So 40% of the UK workforce are parents, and there's usually a phase when children don't sleep well. And if there's a child in the house who doesn't sleep well, usually the whole house doesn't sleep well. And this is something which often goes under the radar. Were there any questions so far? I don't know if anyone wanted to ask anything. I can crack on. So I was going to talk about, obstructive sleep apnea, or OSA. So this is a really common sleep disorder, and one that does need a little bit of explaining. So obstructive sleep apnea is a sleep disorder usually associated with snoring, where your upper airway repeatedly closes as you sleep. The reason this all happens comes back to the upper airway. So your upper airway is made of either hard structures like the roof of your mouth, or soft structures like the back of the throat and the base of the tongue. And the difference is, so the hard structures stay in place by themselves, but the soft structure are held in place by muscles. And the issue is that as you fall asleep, these muscles relax. And this causes your airway to just narrow in on itself slightly as you fall asleep. The first thing that will happen is that airflow, as you breathe, will become turbulent. So this makes the soft structures vibrate, which we hear as snoring. But what you find with obstructive sleep apnea is that the airway closes further and actually closes completely. And then you get this pause of no breathing. So this is the apnea. And your body can tolerate this for a period of time, but after a while, it will essentially set off the alarm. And it will pull you back from that deep state of sleep to a shallower state or completely awake. So your airway muscles regain their tone, pull open the airway, and so you can start breathing again. And as that pulls open, you get this kind of choking feeling, which can actually wake you up from sleep as well. And the issue is that even if you were to sleep for, say, 10 hours, it's really poor quality and fragmented sleep, because whenever you drop into the deep states of sleep that you really need to get to feel properly refreshed in the morning, is that your airway closes, you stop breathing, and your body has to wake you up again. So it's an issue about sleep quality. And this is why you get nighttime symptoms of sleep apnea. So this is the loud snoring, the episodes of stopping breathing, and that snorting and gasping as the airway reopens. But the daytime symptoms primarily is excessive daytime sleepiness, so dangerous amounts of daytime sleepiness. You wake feeling unrefreshed. You have all the other issues of that sleep normally gives us good memory and good focus and concentration. So you lose that. You have awful memory, awful concentration, and 20% of people with sleep apnea are depressed as well, which if you think back to how you feel after one night of bad sleep, if you have that for 5 years, you can really see why there is that mental health impact.
David, I know you hopefully I haven't jumped in before you're about to come to it, but we spoke about this before about how common this is, and
yeah,
because I mean, again, I've done presentations before and shared that it's quite a common thing to have sleep apnea. But one of the things that you'd said to me was actually there's a lot of people that have it but don't actually have the symptoms. Can you just share a little bit more about that?
Yeah, so there's sleep apnea, which is the airway closing, and then there's sleep apnea syndrome, which is when you get the daytime symptoms. So there are some people who do have obstructive sleep apnea, and it's graded, so it can be mild, moderate, or severe. And so, particularly at the mild and moderate end, it is quite varied. But that works two ways as well, because you do have some people who have very mild sleep apnea, but really significant daytime symptoms. So this is why it's really important to, meet the patient and actually understand what's happening. And there are also some people, so particularly women, there's actually, you don't always have the daytime sleepiness, but you can have the other aspects of poor sleep, so the cognitive impairment and the mood impairment, but you don't always get the daytime sleepiness. And so I'll talk about DVLA in a moment, but the DVLA is primarily interested in the sleepiness component, about that risk of falling asleep. But yeah, there are some people who do have quite significant symptoms, significant sleep apnea, but don't necessarily have the symptoms. So in terms of who can get it, so the key point is that anyone can. There are some risk factors that make it more common, and the main ones are increasing age and increasing BMI. So if you have more weight around your neck, it pushes in and means your airway is more likely to close. There's other things, so it's more common in men. If you smoke, sedating medications and alcohol, and also the menopause. So one of the effects of progesterone primarily is that it gives more tone to these airway muscles. And so when you go through perimenopause and menopause, that airway can become a bit more collapsible. But the really big stat here is that 85% of people with sleep apnea are undiagnosed. So there's a huge number of people out there who have all of these awful symptoms with that really high risk of falling asleep at the wheel who are not diagnosed. It's 2.5% of the whole population probably have sleep apnea, but when you look at the ages that you get in certain industries, so construction is probably one. So a lot of the groups that we work with, they tend to employ more men. They tend to be older, and they tend to be carrying more weight. And so you can be expecting a sleep apnea prevalence of about 40%. And so if you work with people who are overweight and men, you should be expecting to find it. So it's way, way, way more common than people think. In terms of diagnosis and treatment, so it's diagnosed, it's much easier now. So it used to be through an overnight, you had to go to a hospital and stay overnight for a sleep test, but it's way easier than that. So you wear a device. It's like a watch-like device that you wear on your wrist with a wire that goes over the back of your hand to a socket for your finger, and then another wire that goes up your pajama sleeve and sticks onto your chest bone there. And it takes one night of recording, and that's almost the same accuracy as the gold standard, which is the in-hospital test. So diagnosis is way more simple than it used to be. And in terms of treatment, there's lifestyle advice. So weight loss is important advice. There are some devices, dental devices, which are like gum shields, but with a lower section for the bottom jaw, which clip together and just, there's like either an elastic band or a slight ratchet mechanism that brings the lower jaw forward just sort of millimeters to create a bit more space at the back of the tongue so your airway doesn't close. Snoring and sleep apnea is worse if you lie on your back. So some people can get away with just propping themselves on their side. There is this, they used to say you can sew a tennis ball into the back of your pajamas, but no one to my knowledge has ever done that. But that's meant to stop you sleeping on your back. And then there's the gold standard treatment, which is CPAP, which is this small air pump about the size of an alarm clock that sits on your bedside table and blows air at a low pressure through a tube to a mask that sits either over your nose or over your mouth and nose and just holds your airway open from the inside. And this all sounds slightly ridiculous treatment, but actually if you've been on the receiving end of 10 years of really poor quality sleep, that you fall asleep in meetings, you barely make it home in the car without falling asleep, you fall asleep as soon as you get in, you're ratty with your partner, you look like you have dementia, that actually once you get someone established on this treatment and they get quality sleep, and sometimes it is just 2 days later that you are looking at this new person, that people actually love this treatment. And if you try and take CPAP off someone who's getting that good effect, they absolutely won't let it happen. So I think from a kind of a non-sleep apnea perspective, it can look unusual, but actually this is the way back to quality of life for so many people.
David, you've got a quick question from Christine as well.
It's not so much a question. I was sleep deprived for 10 years with my husband, who had severe snoring, and it was absolute heaven the night he got his CPAP machine.
Okay.
So it's not just the person who has the sleep apnea, it's the person that's sharing their bed
Absolutely,
with them.
it is.
It was just,
is.
and I know that you have this limited time, but I'll just share, we were on holiday and the mask, it broke, and in the middle of the night, I was getting up finding plaster sticky tips to get this mask fixed, because the thought of not being able to get this mask repaired and not have any sleep was just unbearable.
Yeah, I bet it was. But it's really interesting that you say that, because it is true that whenever you treat someone with sleep apnea, you treat the bed partner as well. And the other really interesting thing is that a lot of our patients haven't been on holiday for years because people sleep in separate bedrooms when they have bad sleep apnea. And if you go on holiday, you have to book 2 hotel rooms, which is often outside of the price range for a lot of people. So one of the nice perks, actually, when you fix someone's sleep apnea, people actually start going on holiday again. So it's a nice sort of extra bonus. So I'll talk quickly just about how to get your workplace sleeping better. So the first thing is to understand the problem. So as I half suggested earlier, is that actually people don't tend to come in and say, well, they don't tend to call up and say, I'm not coming in because I haven't slept well. In fact, it almost never happens. It usually gets put through as something else. And workplaces are different, but when you're trying to understand the problem, you have to ask, do you think your staff will feel able to talk about sleep as an issue? Will they be able to say that they get so worried about not sleeping that they take sleeping tablets every night and then get the hangover effect in the morning? So 1 in 3 mornings they actually can't make it into work. Bearing in mind that bi-directional relationship with sleep and mental health, how much of mental health sick leave, which a lot of places would quote at about 1/3 of sick leave, how much of that is related to poor sleep? And the other really big one, particularly in construction, is fear over your driving license, the risk of losing your driving license, what's actually stopping you coming forwards. If people often think that they're almost certain they have sleep apnea, but they won't come forwards because they don't want to lose their job. Is that part of the issue? So the first thing we would suggest to a workforce that wants to understand what's going on is to do a workplace sleep assessment, but really to make this anonymous so that people feel they can actually talk about it. So this is just a snapshot digital survey of either the workforce. So we either do a whole workforce, or we recently did just a shift group to understand what's going on. then is it shift working? Is it young children? Is it sleep apnea? Is it sleeping tablet usage? Because that really changes how you would approach the situation. And you can repeat this to see how things are going over time. And this doesn't have to be, necessarily bespoke. It can be just the other OH data that you're already collecting. And sometimes you can use wearable tech to an extent there. And then once you have that information, you can make a tailored strategy for improving sleep health. So a lot of this is based around awareness and education. In fact, the bulk of it is awareness and education. You really do need to drive engagement. So I think people have known for a long time that you can't just provide a service, you have to make sure that people are actually engaging with it. And you need to have a bit of a tiered service. So what we know is that not everybody needs the same amount of input, but you need to have that kind of pyramid. So we often find that, you can do workshops, they don't always work that well, but you can do those, and you can have on-demand content, which probably suits specifically, particularly shift patterns better, because they have that access. But then on from there, if there are stubborn problems that don't resolve, that you do have a referral pathway. So these are the broad steps that we would suggest for developing a workplace sleep health strategy. I wanted to talk about the DVLA, because if you work in construction or transport, you need to engage with people's fears over the DVLA. So the bottom line with the DVLA is if you are excessively sleepy, then you shouldn't drive, and that's all on the driver. But the problem is that when sleep apnea gets flagged as a possible diagnosis, people get told to tell the DVLA, and you don't need to do that. So you perhaps shouldn't drive if you're excessively sleepy, but you don't have to tell the DVLA until you're diagnosed. And once you are diagnosed and set up on treatment, the DVLA just asks you 3 questions. They say, do you have sleep apnea? You say yes. They say, are you on treatment? You say yes. And are you getting better? You say yes. And then there's no restrictions on your driving. And for perspective, as a sleep clinic, who we do thousands of these assessments, we've never stopped anyone driving. So it's really rare. But the fear means that people don't come forwards. But it's something that you really have to engage with if you want people to come. So just as a conclusion, I would say that sleep disorders are really common. They make a significant impact on well-being, absenteeism and accident risk. And poor sleep can be fixed. Thanks very much. Very happy to take some questions if there are any.